What is GBS and how does it affect children? GBS stands for Guillain-Barre syndrome, which is a rare but serious condition that affects the nerves in the body. Nerves are like wires that carry messages between the brain and the muscles. When the nerves are damaged, the muscles can become weak, numb, or painful. Sometimes, the muscles that help you breathe or swallow can also be affected, which can make it hard to breathe or eat. There are two types of GBS that can affect children: early onset and late onset. Early onset GBS happens within a few days or weeks after a child has an infection, such as a cold, a stomach bug, or a sore throat. Late onset GBS happens later in life, usually after a child has been exposed to a certain bacteria called Group B Streptococcus, GBS. This bacteria can live in the body without causing any problems, but sometimes it can cause infections in newborn babies or pregnant women. What causes GBS in children? Doctors don't know exactly what causes GBS in children, but they think it has something to do with the immune system. The immune system is the part of the body that fights off germs and keeps you healthy. Sometimes, the immune system can make a mistake and attack your own nerves instead of the germs. This can happen after an infection or a vaccine, or for no clear reason. What are the symptoms of GBS in children? The symptoms of GBS can vary from child to child, but they usually start with 1. Decreased feeling in fingers and toes. 2. Pain in fingers and toes. 3. Leg weakness. 4. Leg pain that moves to the arms. 5. Problems walking. 6. Irritability. As the condition gets worse, some children may also have 1. Breathing problems. 2. Trouble swallowing. 3. Facial weakness. 4. Vision changes. The symptoms of GBS can get worse very quickly, sometimes within hours or days. It is important to seek medical help as soon as possible if you notice any of these signs in your child. How is GBS diagnosed in children? To diagnose GBS in children, doctors will ask about your child's symptoms and health history. They will also do a physical exam and some tests, such as 1. Blood tests and urine tests. These are done to check for infections and other problems. 2. Spinal tap, lumbar puncture. This test uses a needle to measure the pressure in the spinal canal and brain. 2. The doctor can also remove a small amount of fluid that surrounds the brain and spinal cord. 2. This fluid can show if your child has an infection or other problems. 3. Electromyogram, EMG, and nerve conduction studies. These tests measure the electrical activity of nerves and muscles. 3. They can show if your child has nerve damage caused by GBS. 4. Pulmonary function test. This is a breathing test done by a respiratory therapist. 4. It shows how well your child's lungs and breathing muscles are working. 4. This test can help decide if your child needs breathing support with a machine called a ventilator. How is GBS treated in children? There is no cure for GBS, but there are treatments that can help your child recover faster and prevent complications. The main treatments for GBS are 1. Intravenous immunoglobulin, IVIG. This is a medicine made from donated blood that contains antibodies. 1. Antibodies are proteins that help fight infections and diseases. 1. IVIG can help stop the immune system from attacking the nerves. 2. Plasma exchange, plasmapheresis. This is a procedure that removes some of your child's blood and replaces it with fresh plasma. 2. Plasma is the liquid part of blood that contains antibodies and other substances. 2. Plasma exchange can help remove harmful antibodies from your child's blood. 3. Supportive care. This includes giving your child fluids, nutrition, pain relief, and other medicines as needed. 3. Your child may also need physical therapy to help with muscle strength and movement. Your child may need to stay in the hospital for several days or weeks until his or her condition improves. Some children may need to go to a rehabilitation center after leaving the hospital to continue their recovery. What are the possible complications of GBS in children? Most children with GBS recover fully with no lasting problems. However, some children may have complications such as 1. Breathing problems. Some children may need a ventilator to help them breathe. 1. This can increase the risk of lung infections or damage. 2. Blood clots. Some children may develop blood clots in their legs or lungs because of being immobile for a long time. 2. This can cause pain, swelling, or difficulty breathing. 3. Nerve damage. Some children may have permanent nerve damage that causes weakness, numbness, or pain in some parts of their body. 4. Psychological problems. Some children may have emotional or behavioral problems because of the stress and trauma of having GBS. 4. They may feel scared, sad, angry, or lonely. 4. They may also have trouble sleeping, concentrating, or remembering things. How can GBS be prevented in children? There is no sure way to prevent GBS in children, but there are some things you can do to lower the risk, such as 1. Washing your hands often and teaching your child to do the same. 1. This can help prevent infections that may trigger GBS. 2. Getting your child vaccinated against diseases that may cause GBS, such as influenza and meningococcal disease. 3. Getting tested for GBS bacteria during pregnancy and receiving antibiotics if positive. 3. This can help prevent passing the bacteria to your baby during birth.